Good evening, everyone, and welcome to the show. Today we are going to talk about a very important subject on our hands septic shock and sepsis. Today we have three very special guests with us today acclaimed cardiologist Abdullah, and acclaimed pulmonologist Neil, and Madison, someone who has suffered from the disease herself, to talk about it. Welcome. So I guess we should start to talk about what septic shock is. Can you guys tell the listeners a bit about it?
Sepsis and septic shock are infections that spread through the body at a rapid rate. Typically, a wound will get infected and the virus, bacteria, or some such thing will enter the blood and move throughout the rest of the body. Septic shock is when this infection causes a rapid decrease in blood pressure. Severe sepsis is when it causes the organs to begin to fail.
Interesting. Now, you had septic shock, haven't you, Maddie?
Yes, I did.
Can you tell us a little bit more about it?
It was awful. I went through multiple surgeries to remove the damaged tissue, and it was on intravenous antibiotics for a few weeks. They were going to just amputate my foot, as that was where the infection was, but I was lucky. I remember getting severely anemic, and they warned me about PSS.
Sounds pretty terrible. Now, Neil, can you tell me more about what professionals in the field are thinking about the idea of the PSS?
Post-sepsis syndrome has been commonly debated in the medical field. Most think of it as a form of PTSD due to the commonality of amputations and the constant hospitalization. It certainly is a very traumatic illness to go through, and due to the disease causing blood clots and inflammation throughout the body, as well as PSS can lead to reduced cognitive function, anywhere from being unable to do complicated tasks to not being able to function independently at all. Multiple organs may be permanently affected by the disease, and they may become more and more commonly infected in the future. This causes patients to have higher anxiety over their health, and PSS is currently not viewed as an actual mental illness, and it is constantly in debate.
Yes, how very interesting. Did you suffer from this at all, Maddie?
Yes, I did. My symptoms were along the lines of hair loss, fatigue, depression, anxiety, insomnia, and vivid hallucination kind of nightmares.
Oh dear. Now, Abdullah, can you tell me about how it affects the cardiovascular system, please?
When sepsis interferes with the normal distribution of systemic blood flow to the major organ systems, it may cause the appropriate amount of oxygen to not reach these major organs. Microcirculation is a key target organ for injuries in patients with sepsis. A decrease in the number of functional capillaries leads to an inability to extract oxygen. This inability is caused by inner and outer compression of capillaries and plugging of the capillary lumen by blood cells.
What are some effects, specifically on the heart and other major organs of the cardiovascular system?
As sepsis gets worse, blood flow to vital organs such as brain, heart, and kidneys becomes impaired. Sepsis can also cause blood clots to form in your organs and in your arms, legs, fingers, and toes, leading to varying degree of organ failure and tissue death. However, most people recover from mild sepsis, but the death rate of septic shock is nearly 50%. Also, the occurrence of sepsis appears to be increasing in the US. The cause of this increase may include aging population and drug-resistant bacteria. As Americans are living longer, the types of bacteria can now resist the effects of antibiotics that once killed them. These antibiotic-resistant bacteria are often the root cause of the infections that trigger sepsis. Therefore, more Americans are living with weakened immune systems, and this has caused the occurrence of sepsis to increase.
That sounds awful. Now, due to being a pulmonologist, Neil, can you tell me about how sepsis affects the respiratory system, maybe?
Most people who go through septic shock can develop ARDS, also known as acute respiratory distress syndrome. This ultimately causes the failure of the respiratory system. ARDS is a common after effect of sepsis, which is caused by the infections of wounds and sores. This can either be bacterial, fungal, or viral. Sepsis usually causes pneumonia, abdominal infections, kidney infections, and bloodstream infections. Most people contract ARDS in hospitals, mainly because they are recovering from infections such as pneumonia or wounds. ARDS is not very common. It depends on many variables such as respiratory illness, like pneumonia. ARDS causes the failure of lungs, which leads to lowering of oxygen levels in the blood. ARDS causes fluid to build up in air sacs called alveoli. This stops the lung from retaining air and stopping the lungs from moving enough oxygen into the bloodstream. Due to ARDS causing alveoli to be filled with fluids, the oxygen intake by the lungs is lowered, so the diffusion of oxygen into the blood being transported around the body through the arteries is lowered. Therefore, the oxygen levels in the blood are lowered. The poor makeup of the blood in the bloodstream can cause pulmonary contusions. Pulmonary contusions, which is the bruising of the lung, are a cause of ARDS. These contusions can cause the edema and blood collecting in alveolar sacs and stopping normal lung functions. This leads to poor gas exchange and increased pulmonary vascular resistance and decreased lung compliance. The lung can fail from the contusions if not properly treated. Sometimes people are wrongfully diagnosed and not treated at all. These contusions can lead to the development of ARDS. Therefore, organs throughout the body do not receive enough oxygen and start to fail.
Yes. Now, Neil, are there any treatments for ARDS?
ARDS is commonly treated with oxygen therapy. Oxygen therapy is used to raise the level of oxygen in the blood after someone has gone through ARDS. It is done by giving oxygen through a nasal prong or nasal mask, which feeds oxygen straight to the patient through their nose. If the patient is still having trouble with their respiratory system, then the doctors can give oxygen through a breathing tube, straight into the windpipe. Other methods of treatment are preventing other complications from arising after someone has already developed ARDS. For example, nutritional therapy, to keep the patient's nutrition intact. They also do things for blood clot prevention and intestinal bleeding. Patients are required to take vasopressors to help with the regulation of hypotension, also known as blood pressure. This will help with the diffusion of oxygen throughout the bloodstream, helping with the recovery of ARDS.
Can any of you three tell me how it affects the blood?
I can. With septic shock and sepsis, bacteria spreads throughout the body through the blood. Due to this infection being in the blood, platelets will begin to die and there will be an excess waste in the blood. There will be highly decreased levels of oxygen in the blood as well as imbalanced electrolytes. That's why blood tests are used throughout the treatment of sepsis and septic shock to keep an eye on all of these symptoms. Though, because of the constant blood sampling, it is very common for patients to become severely anemic.
Are there any effects of sepsis, or after they have gone through it?
For some patients, the cause of post-sepsis syndrome is obvious. Blood clots and poor blood circulation while they have sepsis may have caused gangrene and the need of amputation. Damage to the lungs can also affect breathing and make the patients at increased risk of lung infections later in life. Other organs such as kidneys or the liver may also be damaged and put the patient at increased risk of infection in these organs. The delirium often associated with ICU stays and may be partially a consequence of inflammation caused by sepsis. This inflammation may lead to a breakdown in the blood-brain barrier, which alters the impact on the blood of narcotics and sedatives and other drugs prescribed in ICU.
Oh, how lovely. This is not a very good disease. How can patients prevent themselves from getting this? What kind of symptoms are there?
Get vaccinated against the flu, pneumonia, and any other infections. Properly clean scrapes and wounds, practicing good hygiene, keep an eye on infections, and watch for symptoms of fever, chills, rapid breathing and heart rate, rash, confusion, and disorientation. The earlier sepsis is caught, the easier it is to treat.
Well, thank you very much for the knowledge. We'll be sure to do that from now on. Thank you all for coming today. It's been a pleasure, but that's all the time we have now. Good night.